Great stuff. So before we take a lot of time, I think we've covered a lot of ground in terms of the understanding of the health systems.
Yeah,
Maybe just for the last time, I mean, you're talking about COVID-19 as an issue really that has troubled our nation, but also it has troubled the world. And I think we find ourselves
yeah,
in the situation where we are now, and we're having to make a lot of decisions that otherwise, we wouldn't have made in the past. And there's been a lot of promises to our people about COVID-19 vaccine and this and that. And that has come with a lot of disappointments as well. I mean, what would be the
yeah.
message that you would send to the community in relation to COVID-19 and everything that is actually happening now?
Good. Well, my message will be as like we're trying to reach out and still, emphasize the point is, taking precautionary measures is the best thing. Social distancing, wear your mask, sanitize, wash your hands all the times. Now you don't know who has it, who doesn't have it. So it is important to take precautionary measures. And then with the vaccine thing, I mean, the vaccine being, whatever is happening now, our scientists and our government is on top of it. I think I appreciate the scientists that they could see that, they have to hold it for a while. The vaccine that we received, I think a week ago, 2 weeks ago, we have to applaud them because it could have been just, it's here, let's give them, why not? But then they saw a need that, no, let's hold it until further notice. We are promised that the other one is coming. I mean, this thing it came now. No one knew about this COVID-19. So the government is doing whatever it takes to help the people. So the people just have to be patient. But while we are patient with it, let's let's do the let's keep the precautionary measures underway. I think it will help us. Social distancing, mask on, sanitize, and if you are sick, if you feel sick, test as soon as possible because it's not only for you that you are sick. It's also helping the people that are around you because this
Yeah,
is a very infectious disease. It gets transmitted very easily, especially the second variant.
yeah,
Sorry about that.
no
Yeah.
problem.
So testing is very important because once you know, then you get to self isolate if you are okay, if you are not sick. But once you start to be like a bit sick, then you have to consult as soon as possible. Don't wait for it to depress you, and then you consult at a later stage when there's less we can do as the healthcare workers.
Great stuff. Great stuff. You're talking about something very interesting when you're actually highlighting on the fact that government is actually having the best interest for its people, especially in this country. And we shouldn't despair with the fact that there has been a delay in the rollout
Yeah,
of the
yeah,
vaccine.
yeah.
Because you know how
So
I look at it as well is that it means that South Africa, somewhere deep, we know that we've got very highly qualified people in terms of medical research that will ensure that whatever that is coming in this country that is going to be given to people is actually the correct medicine that is safe
I
for the
was
people.
happy. I was happy our scientists could do that. I was like, oh wow, okay, all right, yeah, yeah,
Great, great, great stuff. But I mean, there is hope. We know that as much as AstraZeneca vaccine is not going to be rolled out now, is actually is in hold while the trials continue being explored and
yeah,
coming up with new data. We know
yeah.
that Johnson and Johnson is coming through.
So,
We know that also there's
good.
Pfizer that is going to be coming through, and the vaccine actually will continue for the healthcare workers. And I think we should appreciate that and appreciate all the work that has been done by the medical researchers out there that are
Yeah, yeah,
enabling us to actually get the products that are well tested and that are safe for the consumption of our public.
exactly. Yeah, yeah, yeah.
No, my brother, just want to appreciate your time and to say thank you very much. I hope that you will continue talking to our people in isiZulu ukuze bezokwazi ukuqondisisa kahle ukuthi
Hey,
ezempilo
it'll
kuhamba
never
kanjani.
stop. It'll never stop. It's only balegi. We can only try, my brother. That's all I always say. We can only try.